Pastors Chooks and Toyin Ogoye. Pastors Chooks and Toyin Ogoye are the lead pastors of Resurrection Life Church, Johannesburg, South Africa. They are passionate about building families and raising men and women who transform and uplift the standard of life in their communities through understanding and applying biblical principles. Pastor Chooks and Pastor Toyin frequently host workshops, seminars, and conferences for transformation. Some of their programs include Kingdom Financiers Conferences, Dream Achievers Conferences, Marriage Enrichment Courses and Seminars, For Wives Only Seminars, Single Ladies Boot Camps, and Limitless Men Seminars. They are the founders of the Power of Women Academy, a group mentorship for high-impact women, and host the annual Power of Women conferences and Amazing Power of Women broadcasts. For more information, please visit www.idelight.co.za and www.reslife.org.za or WhatsApp +27 814 210 835.
Good evening. Welcome to the Amazing Power of Woman broadcast. I am Dr. Choksu Goy here. This broadcast comes to us every Thursday, and on the last Thursday of the month, we do the Ask Your Gynae session, where we have our resident gynecologist who comes to help us learn about the female body and how to take care of it. And tonight is another Ask Your Gynae session. But before I welcome Dr. Gamedze, she is the one who is going to be talking to us tonight. I want to tell you about my book, The Amazing Power of Woman. I wrote this book a few years ago, and quite a few ministries had come out of this book, and the revelation that that God gave us that we documented in this book. I'd like to encourage you to get a copy. Oh yes, get a copy of this book and read it. Yeah. So we to order you the details are on the screen. bit.ly/Amazing Power of Woman book. That's where you get a copy of this book. All right. Tonight we are set to have Dr. Gamedze come to talk to us about cysts, and all the things that you need to know about cysts. I know sometimes these things are such a mystery that it creates fear. But when we are informed, some of these fears, we realize that they are unfounded, or we're informed to better handle stuff. So tonight, it's a teaching on cysts, and we're going to be bringing Dr. Gamedze shortly. There will be an intro video that brings her on, and Dr. Gamedze will be with us for the next half an hour or so, and then I will be back to round up for today. Enjoy the teaching, and then share this broadcast with a sister, with a mother, with a friend, with a colleague. A woman somewhere will benefit from the information that is going to be shared today. Please share this link and let somebody else be blessed by it. All right, we're going to welcome Dr. Gamedze shortly. God bless you.
Dr. Audrey Gugu Gamedze. Dr. Audrey Gugu Gamedze is a medical doctor by profession, a specialist consultant in obstetrics and gynecology. She runs her own private practice where she helps and serves women from all walks of life on a daily basis. She has a heart for women because she identifies, by virtue of being a woman, a sister, a mother, a wife, a daughter-in-law, and understands the journey of a woman, and is still passionate about wanting to learn more about women. She is a born-again Christian medical practitioner. She sees her medical practice as a powerful ministry platform, an opportunity to touch and transform the lives of women and their families to the glory of God. Dr. Gamedze features monthly on our Ask Your Gynae show at the Amazing Power of Woman broadcast, where she helps women understand the female body and how to care for it. She's the mother of 2 children and has been married for over 22 years.
Good evening, dear ladies. Good evening, dear viewers, and good evening to our listeners of Amazing Power of Woman. Again, it's yet another opportunity to share insightful topics around the life of a woman. I cannot go on without expressing my special gratitude to my pastors, Pastor Chooks and Pastor Toyin. Thank you so much again for this platform where we can educate each other as women. Today, we are just dealing with a very common topic. I don't want to make it that medical, but it's more of an information about cysts. I've just said cysts because they can be of all origins. They can come from any structure within the pelvis. But in the gynae space, the commonest kind of cyst is an ovarian cyst. So this terminology, it keeps on flashing here and there, every time, every now and again. And some of us have been even treated for it. What is it? What is a cyst? A very gross definition would be a collection of fluid. This collection of fluid can be in any space within the pelvis. If we can just rehash, the internal reproductive structures of the woman are the uterus. The uterus can develop cysts. Commonest one will be the Nabothean cyst, which is almost found along the cervix of the uterus, which is the mouth of the womb. Secondly, you can have fibroids that have undergone degeneration or that have become liquefied inside. When you look at those on ultrasound, they look like cysts. Number three, we also have the fallopian tubes. If the fallopian tubes are blocked, they can blow up and become very big. And when you look at that on ultrasound, it will look like a cyst. And then we can have the ovaries themselves. If we go back a little bit towards our menstrual cycle, you'll remember that we said that the egg is elected, it is matured. From election to maturity, that's the follicular phase, where this small egg is prompted to grow and mature into an egg that can be fertilized. Then ovulation, it's when the egg or the seed inside the egg pops out to meet the sperm. That area where the egg popped out remains open to form the corpus luteum. So that if it closes again and it doesn't remain open, it can become a luteal cyst. And then another situation is in pregnancy. In pregnancy, we get a cyst that supports the growing embryo. That one is usually called a corpus luteum cyst of pregnancy. And then there are people who have had numerous operations. If the operation has resulted in what you call adhesions or the flimsy nets that are found inside the abdomen, that can result in pockets of collections. Those are called pseudocysts. Commonly in people who've had previous TB, people who've had previous operation, or any other inflammatory disease. So we can see from this definition that cysts are very common, they are of widespread, but when it comes to the woman, why are they significant? They are significant because they can be very symptomatic. That means that they can give you ill feelings. Let me make an example. If you have a follicular cyst, a follicular cyst means that the egg has been elected, it's been developed, but it didn't get to the point of ovulation. So that means that your whole menstrual cycle is messed up because your body is waiting for ovulation to get the right chemical messages. So that girl may have abnormal bleeding, may have no menstruation at all. It can also cause intermenstrual bleeding. Intermenstrual bleeding means that you had your period, it finished, but all of a sudden you see another flow again. It can also result in excruciating pain. The pain can come from different causes. Number one, it can be because the cyst is growing bigger and it's growing faster. It is causing tension on the nerves on the surface of whichever organ is being affected. Secondly, it can be due to pressure symptoms on surrounding structures. Thirdly, it can be because it's undergoing twisting which is what we call torsion. Thirdly, it can be because it has just caused an explosive bursting, which has resulted in collection of too much fluid, and the inside of your pelvis is now irritated by that. Or if it is not that, it can be because it is bleeding. When it bleeds, it can behave exactly the way like an ectopic behaves. Thirdly, it can also result in nausea and vomiting. Most women will tell me that I've got symptoms of pregnancy. And if you are desperately in need of a baby, those symptoms can fool you. And so if you examine that lady, you'll find that there's a huge cyst that is waiting there causing those symptoms. It can also result in infertility. How does it result in infertility? It is because you are no longer in sync. So your brain, your ovaries, and your womb are not in sync because of the hormones that are being produced. If we can go back a little bit, when we were talking about menstruation, you can go back to our recording under menstruation. You will see that we said that menstruation is a result of a well-coordinated brain, ovary, womb signaling, and the rest of the endocrine system. So the main cause of cysts, especially the ones that are in the ovary, is because of hormonal disruptions. Cysts that are in the fallopian tubes, it's because mainly the fallopian tube is blocked. Cysts that are elsewhere outside, it can be because of degeneration, or it can be because of just collection of peritoneal fluid. Peritoneal fluid, our bodies are constantly making fluids to prevent our intestines from sticking to each other, to allow the intestines to glide as they process food. So if that fluid gets collected in between those flimsy collection, you will have what we call a pseudocyst. Let's take a breather a little bit. So should I be concerned if I get a diagnosis of cysts? Not necessarily. Not necessarily. We always say that it depends on what is the main symptom. Number one. Number two, which age bracket are you in? So that will help you to get worried about the cyst or the main symptom that you have. Let me just address as to who gets ovarian cysts. It can be any woman of both reproductive and non-reproductive ages. There are little girls who are born with malformations, where you find that as the organs were being formed, some cysts got to form. Those ones can sit there innocently, causing discomfort on the baby. It can also happen to young girls in their early puberty, because remember we said that the hormonal sync from brain to ovaries and womb is still developing, it's still being established. So in those girls, you may find that they are much more prone to developing cysts. And then the mid-age or the reproductive age women, those can also get ovarian cysts or any other form of cysts. It is very common with ladies who are on the progesterones for contraception, without being biased, but the Mirena is one of the commonest associations with ovarian cysts. And then also you can find women with what we call polycystic ovarian syndrome being much more prone to developing cysts. And then with the menopausal women, those are also common, but those ones can be very suspicious. So if a lady in the menopausal age develops an ovarian cyst, it is very, very crucial that that woman gets urgent attention to find out what is the nature of that cyst that is found in that space. So for the purposes of this presentation, let me just home in towards ovarian cysts. So ovarian cysts, like we have said, they result in hormonal imbalance. They have a potential to resolve themselves once the body realizes that, no, something is not going the way I'm expecting here. Given time, it can resolve itself. There are those who get what we call chronic ovarian cyst, where now the body tries whatever it wants to try, but it cannot spontaneously resolve that cyst. So that lady will have persistent symptoms in and out of the cycle, depending on whether the cycle is continuous. So what normally happens to the cyst? So it can stay the same, it can burst spontaneously, or following trauma, it can grow like the one of pregnancy. In the first trimester, it tends to grow with the pregnancy. And then as the pregnancy gets established, then it starts receding. It can transform itself depending on the age, of course. If you are perimenopausal, menopausal, it has a potential to transform into a cancerous cyst or become borderline or eventually malignant, which is cancerous. So what should I do? I always say that the lady who has a health-seeking behavior is less likely to suffer complications. What do I mean by that? If you see something that is unfamiliar, or if you meet a condition that is new to what is common or your usual pattern, please do get help. Help can be at any level of care. Sometimes you go to your GP, and GPs are very useful. They can either treat you effectively, or they treat and the treatment fails, then they refer you to the next level of care. Or if they see that it doesn't even need initial treatment, you need to be referred straight to the next level of care, they do that. So the treatment is tailored according to, number one, what is the main symptom? Number two, what is your age bracket? Number three, if you still have a desire for fertility or desire to have children. Let's dig into that. So if we say that it is tailored according to the age group, it means that if a little girl comes in and has this huge ovarian cyst, regardless of how suspicious it may be, if it is huge, you will want to do a procedure that is going to save the integrity of that ovary. You would want to find out what it is. If it is innocent, you drain out the water and the child continues to be well. In the reproductive, in the early puberty group, usually we do what we say, it's a watch and see. Watch and see is still part of treatment. You monitor the patient's progress, you monitor and treat the symptoms. So if she's vomiting, you reduce the nausea and vomiting. If she is having abnormal bleeding, you treat with an aim to reduce the abnormal bleeding. If she is in pain, you treat the pain. So, and you do a monthly monitoring of the size, the nature, and also any complexities within the cyst, including blood supply to it. If those change, then you know it might be a very crucial time to do an operation. Goals around the use of that ovary. If it is a lady maybe in the menopausal age, that lady may not need both ovaries. You may be able to take out that ovary that is affected and analyze what is happening into it. If you need to go back and take the other one, you do that. If there's no need, then that lady would be treated by that. in that manner. If it is a lady who is still interested in having children, you do an ovary sparing procedure. That will depend also on what is the nature of that cyst or how complex it has become. So we said that we can do a watch and see. The second thing we can use the contraceptive pill. For an example, the combined pill is very useful in number one, putting the ovaries to sleep, giving them a good rest. As they recover, they absorb the water that is contained in the cyst, and then you go back on track, they rate you, and then they also reduce the flow. So contraceptive pills, I always say that in gynecology, they work like domestos, or they work like bicarbonate of soda. Anyway you want to use it, it will be effective. And then surgical. Surgery is usually preserved for acute emergencies. Number two, it is reserved for persistent ovarian cyst. Number three, it is reserved for fast growing cyst. Number four, it is reserved for those cysts that change personality. And number five, it is reserved for cysts that are in the menopausal range. Let's try and attend to this one by one. There are ladies who will have a big cyst twisting around itself. When it twists around itself, it causes severe pain. That severe pain results in clotting around the stalk. The clotting around the stalk deprives the cyst of some blood flow. For an example, I give you a balloon, you blow it. After blowing it, you twist the stalk to make sure that the air doesn't escape. That is a similar phenomena that happened with ovarian cysts that are twisting. So that is a gynecological emergency because it starts making the lady to have symptoms of she cannot breathe, symptoms of the pain is very much unbearable. So when it comes to that, I always advise my ladies that don't even wait to get your husband who is in Germany to say whether you can go for the operation or not. As soon as the doctor says that I am suspecting that there is a torsion, or as soon as you feel that your symptoms are so extreme, please do allow for surgery. Number two, we have said that it is reserved for a persistent ovarian cyst. If the cyst does not go away, regardless of that you are on contraceptives, regardless of the fact that you are being followed every month, it is just there. That means that if you want to be pregnant, you will not be able to fall pregnant because your cycle is not restored. It will mean that also if you want to have your pain symptoms gone, you will not have those pain symptoms rectified because the ovarian cyst is not resolved. So that will happen with cysts that are usually located in the inner portion of the ovary where the whole wall system is so thick, it's difficult for it to break through. The third area where surgery is relevant, it's when the nature of the cyst is suspicious. So if there is excessive blood flow, if inside it you see like the small coral reef situation inside, that is a sign that it is not an innocent cyst. Also a cyst with a combination of solid areas and watery areas, that is a sign that it will not resolve on its own, it needs assistance. The other part where we need to do surgery, it is when the cyst is persistently growing. It is not involuting. That means that it is not responding to treatment. The last one, we said that if a lady is menopausal or perimenopausal, most of those cysts can result, number one, from the fact that the periods are no longer consistent, so the message that comes from the brain to the ovary is somehow distorted because of the body's desire to get into menopause. So with that, you may find that some of the eggs get the half message, don't get the right message, but the danger there is transformation. The cyst is most likely to transform into something that can be dangerous or into something that can be pre-malignant or malignant. What about the cysts that occur in pregnancy? Cysts that occur in pregnancy, we don't do anything with them. We preserve them because we know they are supporting the embryo. And as the pregnancy grows, they usually reduce in size and they usually involute. With menopause, of course, we remove the whole ovary. We don't do the ovary sparing. We don't shell off what is affected, but it's the whole ovary. In some cases, we have to remove the affected ovary and also go over to remove the healthy ovary. If the cyst is not arising from an ovary, for an example, it's arising from a tube, that can be drained instead of the whole tube being cut off. I can slightly diversify there and say that most of the ladies who are trying to have babies and have come to the point of going for in vitro fertilization, those ladies, usually you find that there is a problem with the tubes. So if the tubes are blocked in such a way that they have formed huge balloons, so we'll drain that fluid and block those tubes so that the fluid does not come back into the womb to affect any possible pregnancy. And then if the cyst is arising from a pseudocyst, what we just do, via a laparoscopy, we go inside, we clean out all those flimsy things that are there, clean them out, drain the fluid, wash out nicely, and usually that treats the pain. And if there's an infection, when we do cultures, we also treat that infection and usually the pain resolves. If it is coming from a degenerating fibroid, degenerating fibroids usually happen around pregnancy or around a particular time in the cycle. Those fibroids need to be removed or they can be embolized. With embolization, we block the blood flow to the fibroid so it is no longer able to continue nourishing itself, or we remove the entire fibroid with its a juicy filling inside, and that usually resolves the cyst. If it is a cyst that is in the cervix, which can be an abortion cyst, usually that one resolves on its own, but it has a correlation with miscarriages if the woman is pregnant. So if there's an abortion cyst, there's a high chance that that lady will have a stitch put around so that it doesn't trigger any early opening of the womb. I hope from that highlight of information around cyst, it will help us trigger a health-seeking behavior as always. And thank you so much for listening to yet another topic of the amazing power of woman. And please do keep your questions coming so that we know which areas of interest that you would like us to speak about. And also, if we get enough questions, we will have a Q&A session where we attend to your personal question. God bless you. Till we meet again in the amazing power of woman, Ask Your Gynae session. God bless.
Wow, Dr. Kameze, thank you so much. Thank you for the way you explain things, the way you take your time to just bring understanding and bring peace to the people who listen to you. Thank you. Thank you for all you do to minister to women in our city every day, working with women in the theater, in the wards, in the consulting rooms. God bless you. Thank you for your ministry in helping women get better even with their health and with their lives in general. God bless you. Well, tonight we've heard it all on cysts, please share this broadcast, share this information with somebody who will benefit from it. And let's be informed, let's be knowledgeable, and let's be equipped to deal with the things that we have to deal with. God bless you for all my daughters, all my sisters, all my mothers, everyone who is hearing and listening to this broadcast. God bless you. Apply what you have learned, and we'll see you next month for another edition of Ask Your Gynae. Ask Your Gynae session will be coming to you last Thursday in the month of August. God bless you. Bye-bye.